My name is Dr. David Lee, and I'm a surgeon at Southern Indiana Surgery in Columbus, Indiana. And I wanted to give an update on where we are in the medical community here in Columbus with the coronavirus pandemic. This week, as you may know, Indiana Governor Holcomb has determined that it's okay to start doing elective surgical procedures on April 27th. Now, I believe that we're not out of the woods with this pandemic, but it does seem that cases in our community may have peaked. Perhaps just as importantly, our medical personnel in this community currently do have enough PPE, and we have been able to increase our local testing capacity significantly. I do think, though, that we're going to be looking at social distancing restrictions for quite some time. So what does this mean if you need surgery or if you get sick? What should you do if you or your family has to have a procedure done? Well, what this means is if you do get sick, it's okay to go to the doctor. It's safe to go into the emergency room or, if necessary, to have surgery. At Southern Indiana Surgery, the most important thing to us is the health and the safety of you and your family. So what are we doing to keep our patients safe, and what is Columbus Regional Hospital doing to keep its patients safe? Well, currently at SIS, we're seeing patients on a telemedicine platform as well as in person, whichever is more appropriate. The experience of using telemedicine is a little bit different, but it's not that much different from using Skype or FaceTime. It does require installing a secure app on your phone. Our personnel at our office are happy to walk you through this prior to your appointment. For patients coming into our office, we are spacing out office visits, so it should be easy to maintain social distancing guidelines. We are asking patients to wear a face covering if possible. If you don't have one, we'll give you a mask to keep when you come into the office. For patients needing surgery, we're resuming elective outpatient surgery procedures on Monday, April 27th. So what are we doing at the hospital to keep you and your family safe? Firstly, it's safe to go to the hospital. The first thing that happens when anyone enters the hospital is that they have their temperature taken and they're given a mask. You are not going to accidentally run into somebody who is suspected of having COVID-19 or who has COVID-19. All known and suspected patients with COVID-19 in the hospital are on an isolation unit or in the ICU. You have heard about testing shortages, and you've also probably heard that COVID-19 can be asymptomatic in many people. As such, we have prioritized using our testing capacity to test every person scheduled for surgery 2 days prior to their surgery. This allows us to get the results back prior to the operation, and you'll have the confidence not only that you're negative, but also that everybody else who's having a procedure done that day is negative as well. We're starting with elective outpatient procedures that don't require a stay in the hospital. Assuming our community COVID cases continue to decline, we hope to move to doing procedures that do require an overnight stay over the next couple of weeks. It's our goal at SIS for you to be safe. I want to emphasize a couple of things. It's safe to go to your doctor's office if you get sick. It's safe to go to the emergency room. It's safe to go to the hospital. We get it that nobody really wants to have any medical procedures done. Most people find having surgery to be scary in the best of circumstances. But if you do need to have a procedure done, be assured that every precaution is being taken to keep you, your family, and the medical team safe in this crazy time. If you have any questions, the best place for coronavirus information remains the CDC website, which is cdc.gov. Feel free to call our office at Southern Indiana Surgery anytime at 812-372-2245 or go online at sisurgery.com.